already something you already kind of know what's going on with. It's not like I'm going to tell you anything new. I think it might just give you a little bit more clarity here. So when it comes to your shoulder capsule here, or when your shoulder joint here, what we do is we pretty much have the capsule. The capsule is pretty much a bag that is surrounded the glenohumeral joint, or the shoulder joint. And what happens is sometimes it gets really tight from muscles pulling on it, from ligaments shortening up around it, and so basically what happens is it's restricting some of that external range of motion. And I can see that you're a little bit more not guarded on that. I think that, typically when you see in frozen shoulder issues, you tend to see people like have first limitations going into your back pocket. And I don't think you're having limitations with the range of motion. I just think you're having some pain. So I'm wondering if is it just a capsule issue, which I think that technically frozen shoulder is what we call adhesive capsulitis. That's pretty much like a capsule here, or the joint here, kind of coming in and just getting hardened over and frozen over, and it doesn't move as well. I think that's what's happening a little bit, but not majorly on you. It's very hard to say if it's progressing or not, because obviously it's the first time I'm seeing you. But I did mention something before. I said, a lot of these cases are dealt with autoimmune issues, thyroid issues, things like that. So you do heavily see a lot of frozen shoulder stuff with that. Hormonal changes, female, very, very common. So I don't think it's like very bad at all. I think we should just treat it and try to work the capsule, because it is going to strain a lot of the rotator cuff muscles that attach and do these as well.
Which is preventing me from like doing the
I think so too. But also when you lift your head or your arm and your neck and you go into overhead range of motion, what's going to happen is that you kind of have to use your upper trap, and you have to use all the musculature to kind of like go up. And so you have a good amount of compression going on into the neck that it's sending that radicular symptoms down. So I think this is a very good, valuable technique that we're going to go over and do ART and all that other stuff, because it's going to try to ward off some of the stuff. And I'm going to give you some exercises too and rehab stuff. We're not just going to just treat it and say, hey, go back to your normal life. Like, hey, let's treat it. Let's try to make advances on, see how we can do with that route.
Okay.
When I come to this nerve issue here, what a lot of times people will have is that they'll have irritation to the dorsal scapular nerve as well, that goes down into here. It's like always super tender.
Always.
It's really tender, but if your shoulder is like, let's just say, locking up in the front of the capsule here, you're going to be closed off here, which is going to pull a little bit of the neck in the wrong position. It's going to pull this one a little bit more, and it's going to cause more irritation to the shoulder because you're not in a good position. A lot of my things that I did on you testing was like closing down the foramen, and foramen is just Latin for window, where the window where the nerve comes out. So if I was closing the window on your head, it wouldn't feel so good. So I was doing this and closing the window down, and that's what was shooting down on that area. And what makes me a lot more confident on that, and one of my finalized tests that I did is I did that weird test when I reverse handshaked you, and I said what I'm gonna do there is I actually took that nerve and I pulled it down into the arm, right? And then I said, hey, that hurt? You're like, yeah, that hurts. I don't like that. Feels like that pain. And so what I did is I had you place your neck this direction, and that creates more slack for this to travel down, and that actually kind of relieves the nerve a little bit. If it still hurt, then we could potentially theorize that it might be caught up in the arm, potentially, not all the time, but potentially. And then sometimes, so if I did that and I took your arm and I stretched it going down this direction, down this arm, and I pulled it this way and I went the other way, it would pull it even further and cause more issues. So in your case, stretching the neck is actually going to cause you more irritation.
Got it.
And that's why, like, a lot of people say, like, lock the shoulder down, make sure you stretch it. I'm like, I think in your case, I bet you if you did that right now, and you're free to try it because you're here, but don't do this at home. Like, if you just kind of bend your head the other way, you probably feel a lot more symptoms.
Yeah. So
So I actually, and so this is one of the benefits of ART is that, and manual work, is that somebody's doing the work for you, but they're being localized in that vicinity of here, right? We're not going other places. So I think it's important to work the nerve course, and I think it's important to work that area, but I do think that these two locations have a direct result one on another. So what we'll do is we'll do both.
Okay.
You know, we'll work both. We
Okay.
got plenty of time to do it, and we got to work the whole shoulder girdle. I think I'm going to work a little bit of the capsule. Capsule is probably the thing that's going to give you the most, I don't want to call it irritation, but it's going to give you the most, like, you're going to feel it. You're going to feel me working in there.
Okay.
It's not the most comfortable, but it's not, like, the most uncomfortable.
Okay.
But communication, you let me know. It's not about hurting you, it's about getting you better.
Okay.
Do you have any questions for me?